Yes, I remember the last time to talk to you, it was during the activity of making the review of scope of practice for nurses and the midwives on the Tanzania context. That was the first time to connect with you during the interview I did with you while seeking for the expert opinions. Yes, looking at your history, it's very exciting, very exciting. It looks like it was a real, not easy task to move the nursing education from diploma training to degree. The huge community who are following up this interview would like to know what were the struggles did you face during your mission, and how did you stand firm? What means did you use to make sure that you go through those challenges and you fulfill your desire? And where did you find that kind of courage?
Yeah, at this time there were many struggles because you remember I was the only one with a degree and a master's degree in Tanzania. And when I talked to my colleagues, they did not understand really what I wanted. So I formulated a committee of a few nurse tutors, like 4 of them, those who were ready to support me. We decided to work hand in hand. But then every time we went to, for example, at the university, I had to walk from department to department to seek their support. And you would sit together in a meeting, discuss and agree. But then when it comes to reporting to the academic board, they would refuse that they had ever seen me at all. So at least I remember one department who was the secretary of our meeting, our discussions. He took the minutes and then he went to the department. And then he said, he went to the academic board and he said, I don't remember to have discussed this. So he had I had the minutes and he was the secretary for that minutes. I said, now man, this is what you wrote. So he was ashamed of that. But even in the ministry, the minister was very much against this and said, do you think that a degree will be needed for a nurse to give a bedpan? I said, sir, you can even do it very scientifically if you want. So it's not only about giving bedpans or doing whatever, but it's about the scientific background of giving rationale for whatever you do. So it was a bit hard anyway. But I must say, through the project and the support I got from the House University, we stood by we were strong and we stood up. The issue was that I did not give up, regardless of whatever people would tell me. And even when I sent those students into the House University, at the ministry they were saying, those are Mella students. They were not students for Tanzania, but Mama Mella's students. So that's what it looked like. However, when we succeeded, then people accepted.
Wow. Okay, well, now our area of discussion for today, we are looking on the trend of nursing professional advancement in the Tanzania context. And thank you for sharing your journey, your history in nursing. And it was great to hear, of course, where did you acquire your nursing education, including your struggles, your missions, until it was successful on making sure that at least in East Africa we have the bachelor level of education among nurses. Now, looking at the trend of nursing advancement, of nursing improvement, where do you think we were the past status of the profession?
We had only one training institution for grade A diploma nurses, and that was at the Princess Margaret Hospital, or Muhimbili as it is known these days. And we had a few faith-based institutions which were training grade B nurses. Of course, there were different cadres, but those two were the major ones. Even by the time I obtained my degree, nobody was interested in higher education in Tanzania. We had nurse tutors who had been empowered, only 4 of them, but they seemed to be satisfied with what they had. And when I started talking about higher education, the degree in nursing, everybody saw me as a lost sheep, from the highest level, that the ministry, to the lowest level. So that's where we are. And I was not satisfied to have only a diploma program in Tanzania, because in my exposure outside, I saw other levels of training.
For your observation, what do you think now we are, especially on the side of the current status of nursing profession in Tanzania?
We have a bachelor's degree, we have masters, we have PhD, even though they are few, but at least we are going that direction. And we know Muimbili is running PhD programs, UDOM is running PhD programs, etc. And we would also like to see more universities developing programs in a variety of specialties, like mental health, psychiatric nursing, pediatric nursing, oncology, geriatric, palliative care, etc. And also want to see new universities coming up. At least one university which is training nurses in each region, if we can meet that target.
Currently, as you shared to us, we see so many specialties rising in nursing. We have those nurses specialized in ophthalmology. We have those nurses specialized on pediatric oncology, nephrology. For your observation, what these specialties or advanced skills means, especially for the profession globe of nursing profession?
Changes are taking place. We are going into technology, and at least we need also to match with what is going on. Like our colleagues, doctors, are doing super specialties, and there needed to be some nurses who can work together with them. Otherwise, we will be left behind, and then our responsibility will not be achieved. So we have to match with whatever it is. And as nurses, we have realized that higher education is very powerful. So, and I'm observing some of them having interest in research. So before, the nurses were being used as data collectors for doctors, but nowadays nurses are coming up by themselves and developing their proposal and doing their research proposals and even writing. And I'm very pleased to see that our new act, the act which was enacted in 2010, had some opportunities for expanded roles for the nurse, and this has been taken up by many of the nurses, but not many yet. I think we need more nurses who will take up the roles of expanded nursing and so on. However, yes, that's about it.
I understand the fact that you are also a reviewer, article reviewer, review of papers in some of the journals. What's your say on side of research outputs from nurses, the contribution of nurses on developing scientific evidences?
We are the practicing people, and when you are doing something for some time continuously, you need to observe some trends in the patient care, and those observations are best to be researched on so that we can improve the way we provide care. So that is another area which is very, very important. And when we do that, then we need to share that information, not to hide it somewhere. Unfortunately, we do not have many journals that can publish our research findings in Tanzania. In the world, there are many journals, but we need also to have some journals in Tanzania where we can publish our results that can be shared locally and internationally.
Oh, wow.
Actually, we see challenges as gaps. Those nurses who have already acquired the program, they wish to advance further, they cannot because they have financial problems. the ministry is not supporting them as much as they support our colleagues, doctors. So it's very hard for a nurse to get a scholarship or fellowship for advancement. And also, some of them may have joined families and they have problems with managing their families, so they cannot leave their family and continue with the training. And the new students who are coming from secondary school, they have no clear idea of what nursing is. So they have a vague idea, and most of them really wanted to go to medicine, but because they cannot be accepted at the very beginning, they use nursing as a stepping stone. So you will notice that when they come here after 1 year, they started looking for opportunities to move from the nursing program to medicine, which is very bad. At the same time, our community still have a negative image of the nursing and regarding the nursing profession. And this is because they don't have enough information about what nursing is like. However, I think now they will see, because we are doing very good things, especially in relation to our pandemics, like the HIV pandemic, the COVID-19. So nurses are in the front line and they're doing a wonderful job. Academician nurses who are doing research, and if they base their research on evidence, then that can be used to improve the profession, to improve the clinical practice. We need to strengthen our collaboration with the clinicians who are based on the clinical side. So we do our research here, but also we need to collaborate with them so that whatever we are producing can be used to improve our situation. At the same time, also the scholars could do regular curriculum review to update the content that we teach our students so that we match with whatever is changing. We have so many emerging issues, and we have a technology which has been introduced in the system. So we need to be up to date. But then we have to be very careful that this technology does not move us from the hands-on system that we have. That means the relationship, the touch that we have with our patients.
Are you satisfied with output of the ideas that are coming from side of the nurses? Of course, on different sections, in research and in practice, clinical practice as well.
From the very beginning, except our innovation was based on mega resources. So when you do not have a resource to do something, you improvised. So that was, I call that innovative, because we did not stand still and say we don't have this, so we cannot do our job. So that is one. But we need more scientific innovations so that we can now use that to base our research and move from the whatever, I call that a closed box, that we have been prepared to care for patients, and there's nothing else we can look aside. But there are so many changes in the technology that we also need to be addressed to so that we can match with the system. No, the platform is not there. So I think we need to establish a platform and a forum where we can share those innovative outcomes, and after sharing, then we can display or publish or do something that can be read by many and be applied or implemented in the system, the healthcare system, to improve our practice. We need also to be very, very close to technology so that it does not pass us by. does not leave us behind. Because if we are concentrating, we know that we need to be caring with passion and touch and everything. But also the technology is coming very fast. As when I was in the US, for example, you will have your patients over there and you are seated here with your monitor. So you are not even touching the woman, but that is not what I wanted to happen in this country. So use your monitor, do everything, but also some more closeness to the patient. If you are innovative, you can still use the technology and still use touch as part of the care.
Okay, thank you. Looking at the nursing professions, we have different levels in nursing. Where we have academic, we have of course certificate level. In nurses, we have diploma level, we have degree, we have masters. Do you think it's like the? Do you think we would like also, of course, to have those consultation system, especially when it comes to the practice in nursing? Are you satisfied with the way things are moving, especially on the side of consultation? Or you think there is any way maybe consultations can be implemented, especially in the clinical practice?
Consultation is important. Why not if you have the experts? And the experts are there to be consulted either by junior nurses or by other members of the healthcare system, so that we can work together to bring about change to our patients. And therefore, we needed also to move away from the routine. Experts, the specialty experts in clinical practice should be available for consultation, especially to new employees, intern nurses, and anyone who needs that. And also from our colleagues whom we work together as a team in the clinical setting, including the doctors, because we assist them a lot and we help them a lot.
Yes, thank you. One of your desire, Professor Mella, was to see nurses working independently, making the decisions instead of depending on every decision which doctors have to make. Now, do you think it's the right time to introduce a prescription, nurses to prescribe, because of huge advancement, especially in nursing profession we see currently?
Personally, I think you shall not take a prescription as it is done by doctors. We nurses do assessment and prepare care plans for our patients. So some of the things which need immediate prescription, so I would not like to call that prescription, attention, then we need to be able to implement. For example, if you are doing some assessment and you notice your patient has a high temperature, you don't need to wait for a doctor to come and tell you, prescribe for you a Panadol, aspirin, or whatever to reduce that temperature. So you should be able to do some implementation and do that. Now, prescription in terms of what the doctors do, I don't accept that one. I don't accept that one.
Okay.
There are areas where you have to do some implementation. For example, in maternal health, in mental health, you see a patient is very aggressive, you should be able to do something. Give something to reduce that aggressiveness. Give something to reduce that. So I would not call that the prescription as such. I would like us to use a different name altogether. Because then that will be saying, we want to be prescribed like doctors. A doctor prescribes and disappears. But you are doing the prescription that you implement. So you are not disappearing, you are not leaving. So he doesn't, he just writes on the paper and he leaves it there for somebody to provide or to give to the patient. So I think right now we should look for a term that will help us and protect us from our act, that we are not looking for the prescription that is done by a doctor. I see it going further, very well advanced, and matching with the technology and everybody in the world, and that we have more experts in PhDs and the sub-specialities. Just we can practice it together. Nobody is left behind. We were able to do at that time when they had less knowledge and less technology, and it is good to have history. When you have a background, you know where you came from. So you celebrate the achievements that were done by these people, and we appreciate their contribution. By appreciating that, then we can work together and improve the future as you can see it.
I can't escape from saying that you are a true copy of Florence Nightingale.
I am
no.
not.
you are together having a very exciting history, and it's because of the significant contributions you are making. You personally, you are making, especially on side of profession advancement, nursing education growth, and of course on side of improving the quality of nursing services. For your observation, what is the best way you think it's good to commemorate the founder of modern nursing?
There are some research, some achievements, nurses who have done best in their clinical practice, and even award them and use that best practice in other areas that they have not achieved that much. So that one will be in the advancement. And the second one, we need to be happy that we had somebody like this who stood firm and made sure she cared. It was not easy to care for soldiers at that time. And she had no light, she had nothing.
Looking at the nursing profession currently, we have a huge number of nurses, of course, at the level of students and on different level of educations in universities, colleges. So there's a young generation of nurses this time around. Now, I would like to hear from you, especially on side of your advice, on the ways they can make the positive contribution in as a changing agents in the profession, especially on side of the profession as well and health care.
So the first thing is to maintain professionalism and very serious adherence to professional ethics. So that is number one. They have to stand by that, protecting their ethical standards. Also, they could be creative by networking with other people and sharing ideas locally and internationally. At the same time, they needed to be committed, really. To be committed, that means they love the profession, to show their love, and they should know that nursing is a lifelong profession. Once you enter there and you enter with the commitment, you remain there. And they need also to be involved in different activities in terms of thinking and acting outside the box. So they should not have the idea that I'm a nurse only, and even avoid the statements of saying I'm only a nurse. That should never happen. So they should be comparable with the other colleagues, and internationally and locally. I wish they could find some role models that they use to stand by and to stand firm in their profession. And even themselves, they should also aspire to be role models for the other people and even for the community. When the community meets a nurse, they can say, aha, this is a real person. We remember before we said we needed to educate the community to know the characteristics of good nurses. So once the community knows that and they meet these role models, then they will accept us more.
Okay.
So I welcome them to the profession. This is a very satisfying profession. It is very challenging, but very, very good.
Okay, thank you. Thank you, Professor Mella. Yes, to say that's a very professionalness, or to call someone as a professionalness, how he or she should look like in terms of characters, behavior. Yes, your observation on this, please.
First of all, the way you talk. Your words tells you a lot about yourself. The way you walk, the way you dress up, your general appearance from head to toe, the way you keep yourself. If you are a man, have you shaved properly? Have you done your hair properly? If you are a woman, have you done your hair in such a way that it is not disturbing the patient? That means you don't have to do that long plaiting hair up to the back and so on. Even your dressing is very, very important. And the way you relate with other people is very also important. You do not do things that people will see you and say, oh my God, who is that? So at least you behave in such a way according to the norms of the community. They can say, that is a respectable person.
Sharing of responsibilities across health professionals in healthcare industry. Of course, some they say it's a concept that has been introduced to solve shortage things like people to share their roles and responsibilities during care and treatment of the patients. What's your comment on that? Do you think there is any benefit around task sharing, especially on the side of nursing profession, or it's a risking the identity of nurses? Please, your comment on that.
If anything goes wrong, then you will be charged. Was this in your professional standard? Was this in your scope of practice or not? So the nurse must use her intelligence and a clear understanding to see which one am I going to share and which one am I not. And I don't believe that these days there is so much shortage that you will find that a nurse has to do something that is not allowed in our act.
Okay, thank you, and thank you for your observation on that. I understand that you have won so many different awards, both or local awards and international awards. Yes, I would like to hear from you. What are you proud of most?
1978, I got the 3M Fellowship Award. That is one, the very basic, which made me step forward and go for my studies. So another one, I have won an award in 19, what year was that, Mungu? I don't remember. So I have other awards like the ones I won in Thailand, Princess Sri Nagarindra Award. That was a very big one for outstanding performance in my profession, and it gave me a lot of pride. I have also an award in nimekwenda wapi nyingine, Mungu wangu. I have also awarded the American Fellowship Award, which adds on my credentials. That was in 2016. At the same time, I had ilikuwa inaitwa Taylor and Francis Award. That was given by Women's Health International. And here in Tanzania, when we were celebrating the 60 years of the Nursing Midwifery Act, I was awarded as one of the best performance in nursing by the President, Jakaya Kikwete.
Oh, wow.
And recently I got this Clouds Award.
Wow. You've shared it to us.
Yeah.
Yes, Malikia Wangufu. Oh, thank you also on behalf of Professor Mella to Clouds Media Group for that award. Of course, she deserves better, and you are well deserved for all of the awards you have won. Of course, it was really great to catch up with you, Professor Pauline P. Mella, and thank you for all stuffs we have shared with us. And I understand that this is going to contribute to the huge impact, especially on side of nursing profession. I know there's huge of community following up our conversation live on YouTube, and the different students who will be so much inspired through all of the things you have shared to us. And we are very proud to have you, especially in the nursing profession, and congratulations more and more for the significant contributions you have made, especially on improving the quality of nursing education, including the nursing services in Tanzania. Thank you for staying with us, and thank you again for following up our conversations. Remember, we were discussing about the trend of nursing professional advancement in Tanzania context. You were with me, Ruchus Philbert, a host of this conversation, and I was with Professor Pauline P. Mella from Tanzania. Until next time, keep staying in touch with our different programs, presentations, and discussions through our platforms.